Hi, Dr. Curran. Thank you for taking the time to speak with us about your work. We are very excited for the opportunity to hear about your experiences firsthand. The questions that will facilitate this discussion come from public health students across the United States who read the 1987 book And the Band Played On: Politics, People, and the AIDS Epidemic by Randy Shilts, which features you and your work as one of the first scientists to recognize the infectious nature of HIV/AIDS. So thanks for joining us, Dr. Curran. If you could start off by just telling us a little bit about yourself, your background, and really what motivated you professionally and perhaps personally to become a leading pioneer in the HIV/AIDS research.
Well, thank you. It's a pleasure to be with you today. I am Jim Curran. I'm Dean of the Rollins School of Public Health at Emory University and have been since 1995. In 1981, I was at the CDC as Director of Research in Sexually Transmitted Diseases when the first 5 cases of what is now termed to be AIDS were reported to CDC, and I was asked to lead an effort, a task force, to investigate this, originally for 3 months, but I worked on this for the next 15 years. Currently, I'm also co-director of Emory's Center for AIDS Research.
Great. So we'll jump right in and ask you a lot of the questions that the students submitted over the week from across the United States. So the first question we have is, when did the light bulb go off for you in reviewing the initial data about the disease that came in through the MMWR that something was happening in California?
Well, the CDC is known for and quite accustomed to responding to outbreaks of new diseases. During my time there, Legionnaire's disease was discovered, toxic shock syndrome, and many, many others. And of course, there have been several since the AIDS epidemic. I saw the draft version of the first cases of pneumocystis pneumonia in gay men before it was published. And because I've been working with colleagues on hepatitis B vaccine trials in gay men, I immediately thought that this somehow had relevance.
Mm-hmm.
The other thing that was very, very important was the serious nature of the conditions and the fact that most of the men had already died.
Mm-hmm. So many things went wrong that physicians didn't have control over: lack of funding, lack of awareness, educational campaigns to help educate high-risk groups, and not to mention the fighting that occurred between health agencies that should have been working together to get answers to this public health problem. Was it terrifying to be dealing with an epidemic that the public health community couldn't really get control over or agree on a way to move forward?
Well, I think there were good and bad things. First of all, the CDC is known for its responsiveness, and even though it was under budgetary stress, many people volunteered to work on this at the CDC. Although there was a hiring freeze for new hires. Secondly, the relationships with state and local health departments and doctors were quite good with the CDC. So we had a chance to learn about all the cases. And because we've been working with the gay community with hepatitis B vaccine trials, we had good relationships with many of the doctors caring for gay men throughout the country. Of course, it was occurring at a time when Ronald Reagan had just been elected president, following a previous administration of President Carter, at the end of which was high inflation and high unemployment. And the focus was all on international activities, particularly the Soviet Union, with major promises of cutbacks in domestic spending. So we had problems in terms of getting resources to deal with the epidemic in the initial year.
How were you able to get those resources?
Well, I think that importantly, we focused on surveillance of the problem. And it looked like the cases were doubling every 6 months, and they were universally fatal.
Mm.
And as it turned out, they were involving not only people from New York and California, but then spread to other states, which caused more attention to the problem. And it became aware that this was quite serious and required additional resources.
Right. So in the book, NIH was portrayed as slow to respond, even deliberately so. Do you have any advice for public health professionals working in a system that is not as responsive as it should be?
Well, I think the important thing is when you're working in public health is to try to, first of all, garner all the resources you can, and then do what is best with what you have. There are a lot of public health priorities that are underfunded, and of course, the idea of advocacy for funding is extremely important. But you can't let the perfect be the enemy of the good. You need to pursue the most important things as you can. And for us initially, a very important thing was trying to figure out what was causing AIDS and how it could be prevented and how it was transmitted.
So while he was not responsible for the epidemic, the book made it seem like Gaetan Dugas played a key role in how aggressively HIV spread. Can one person make that big of a difference in the rate of transmission?
Well, he was never identified by the CDC. His name was provided by, I believe, Randy Schultz to the public, but he was a key person in the middle of an investigation of a cluster which suggested to us the likelihood that whatever was causing AIDS could be sexually transmitted. It wasn't that he was the patient zero or that he was the person who brought it to the United States or anything else. In general, HIV is spread, fairly slowly from person to person, and it's unusual that one person would be responsible for large numbers of cases.
That's interesting. So we had a student write in and ask. She says, "I find the author strives to portray the AIDS epidemic and the stories, but strives to do the AIDS epidemic and the stories behind it justice by approaching it from multiple angles as well as characters. However, it is clear that the book is framed and written in a way that does infuriate and sadden its readers. I would like to know, having been in the trenches, what do you think about the book?"
Well, I think the book was written by a very smart, openly gay reporter for a major newspaper in the United States, and he was at every important meeting throughout the country in the beginning. He accurately represents many of the feelings in the community, and he provides a lot of information to people. Now, in writing this book, most of the characters are wearing white hats or black hats. So he does probably glamorize some people too much and demonize other people too much. But that was how he saw it.
Right, right. On page 550, the author states that during a discussion with the reporters at the first International Conference on AIDS, you were quoted saying, "Don Francis does not speak for the CDC. He's only speaking for himself." The author also notes that privately you in fact agreed with Don Francis and his stance on AIDS testing. Can you comment on the internal struggle you faced during this epidemic?
Well, I can't. I can only say that I don't remember exactly the incident you're talking about. Don was a strong advocate for testing, and the CDC was generally pro-testing, but much of the testing that we supported was anonymous because people were reluctant to be tested with their names because they thought it would that they didn't trust the government. They thought the government would have a list of gay people or something like that, and therefore they didn't trust it. So there were careful messages on how to encourage people to be tested. So I mean, the only thing I can think of is that I was the one who was in charge of the task force, and in a sense, primary messenger, but that doesn't necessarily mean that Don and I were in disagreement on everything.
Right. Right. And so as a follow-up to that, Dr. Curran, a student wants to know, was the gay community open to the intervention of the public health system?
Well, the gay community was very important, and the HIV positive community was very important in calling attention and providing focus to the problem. I think that more than any other group in history up at that time, people who were affected with HIV became very knowledgeable and very active advocates. Their life was at stake. I mean, for the first, until 1995, HIV was a death sentence. It was an inevitable death sentence, and it was a horrible death. And so people, became involved, and they often were involved until they died. Mm-hmm. And so, many other groups with breast cancer and other groups now have decided that it is important and it's okay to come out of the closet and let people know of your illness and the importance of a consumer to be in the middle of policies and things like that. So I think that they did pay a lot of attention. Now, that isn't to say that they always agreed with public health officials or the NIH. But in fact, they were very important people to listen to. And in fact, we were mostly on the same side. We in the public health service were not political in the sense that we were not partisan. We're, public servants, if you will, and scientists. They didn't trust a lot of the partisan politicians in the Reagan administration, but they didn't get access to them. So many times they would lobby against us. I mean, they locked themselves to my office and did the same thing with Tony Fauci. But, on balance, they provided enormous value.
Right. So a number of the investigators identified poppers as a cause for suppressed immunity. How much consideration did you give to this idea, if at all?
Well, we thought that, we knew that many of the original cases had a history of drug use and in particular nitrite inhalant stimulant use. And so we didn't want to miss the opportunity of being able to end the epidemic by ending a particular toxin. I think most of us thought that this was going to be a sexually transmitted pathogen, but, what if it were poppers? So one of the things we did, we found out that there was almost universal use of them among the gay men with AIDS initially. But we did studies in the laboratory with mice and other animals to see if nitrite inhalants were immunosuppressant. And in fact, they really weren't. So we wanted to, we didn't want to lose the opportunity of being Carrie Nation and ending the epidemic easily. But we didn't really believe that that was likely to be it.
Right. And so then, to what extent were the blood banks at fault for refusing to take precautionary care in screening donors for HIV?
Well, in 1983, CDC took the lead in publishing prevention recommendations, and the FDA certified them to say that all sexually active gay men and other people at risk, at high risk for AIDS, refrain from donating blood. And they immediately began to do that. It wasn't until March of 1985, about 2 years later, that a blood test, first of all, HIV hadn't been discovered by then. So the recommendations were made for a donor deferral well before the cause was certified or discovered. It was March of 1985 when the blood test became commercially available, and it was immediately instituted in all blood banks in the United States and elsewhere.
Do you have any general thoughts on 90-90-90-50 ending the epidemic and other such initiatives?
Well, it's now known that early treatment of persons with HIV not only can prolong their life and reduce the chances of TB and other conditions, but also can lower the amount of virus in their blood and semen and vaginal secretions, and therefore reduce the amount of transmission. So prevention and treatment go together. And therefore, it's recommended that all people with HIV be diagnosed as early as possible. That's the first 90. That they be referred to care and they receive care. That's the second 90. And that they be given antiretroviral drugs which can suppress their virus to an undetectable or very low level. And that's the third 90. So the goals transfer into, global goals, which really point the importance of linking prevention to care and the need to try to get everybody in it in order to reduce the growth of the epidemic as well as saving lives.
So there was a great deal of tension between the goal of saving lives and not telling at-risk populations how to conduct their lives. Given the times, do you think the balance was appropriate? Should we have been more aggressive, or maybe the better question is, would it have made a difference?
Well, I think we as soon as we learned about the cases in June of 1981, we began to publicize the cases and the growth of the epidemic as much as we could, and with virtually weekly updates. And then we, in March of 1983, which was less than 2 years later, we published comprehensive recommendations on reducing sexual partners, avoiding sexual contact of people with AIDS. In 82, how to protect healthcare and laboratory workers who were dealing with patients or specimens. And this was all before the virus was discovered. So recommendations were made, and I think in the gay community in particular, peer groups also recommended reducing sexual partners and avoiding sexual contact with people who had AIDS.
Right.
Now, I don't want to say in one area we could have done better, in particular, was with injecting drug users. It was very hard to get needle exchange programs started, and it was very hard to get adequate amount of drug treatment for people with drug users. And we knew that injecting drug users were becoming affected with AIDS.
Right.
Their veins.
Dr. Curran, why was it so difficult?
Well, it's people have a real disdain for drug users,
Right.
particularly heroin addicts and others. And it's been we're reminded now with the huge opioid epidemic we have now how a society can allow this to happen. And it gets to be twice as bad as it was in the 1980s before we do anything about it. In general, at the time, heroin addicts were highly ghettoized, and people didn't want drug treatment programs in their neighborhood, and they were very much insufficiently funded. There was much more of a lock 'em up mentality, and that's the new Jim Crow. Lock people up who are drug users rather than provide treatment for them.
So actually, this is a perfect segue to this next question. A student wrote, given the political influences that affected the U.S. response to the HIV epidemic, do you think that our government, public health institutions, would be able to respond to an epidemic of a similar scale today to a vulnerable population? So, I mean, your comment on the opioid epidemic, this is what I immediately think of as a large-scale epidemic that we're facing today, and if our government...
Well, what it points out is many public health problems have to involve politics and have to involve the people. Right. But if the information can be provided through good surveillance, the priorities can take care of themselves because eventually, because the number of people affected, the light will be shined on them. Now it's obviously some people are going to be more well thought of than others, but I think the main important thing is doing good surveillance and providing that information to the public.
The 30th anniversary of World AIDS Day was Saturday, December 1st. Do you have any thoughts in general on how far we've come or not? Not how far we've come battling this disease?
Well, I think we're about halfway there. I'd say in 1981, 1983 or 84, when the virus was discovered, it was the first human retrovirus to do what it did by killing cells, and no one thought that there would ever be any therapy for it. We hoped it would be, but it turned out that by first of all, the modes of transmission were rapidly discovered. Prevention recommendations, as I mentioned before, came out 2 years before the antibody test was even available. And then early treatment with AZT in 1987 was kind of a proof of principle that there was a drug that at least could be partially effective. In 1993, giving AZT to pregnant women and their newborns greatly reduced transmission from a pregnant woman to a newborn. And then in 1995, a combination of 3 drugs has provided fairly normal life for people. And now we find that as many as 18 to 20 million people in the world are receiving these drugs as a result of a lot of advocacy and government generosity. Now, what's missing is the following. First of all, the natural history of HIV is a real problem. Most people, when they're infected, are silently infected and don't know it. So most people who become infected with HIV are infected by people who don't know they have it. And so it remains a real problem with millions of people around the world not knowing that they're infected. Secondly, there is no cure. So treatment is expensive and involves lifelong therapy with 3 drugs. And that's a difficult thing to maintain and do.
Right.
And then the third thing is there are 20 million people who aren't diagnosed and being treated and receiving antiretroviral drugs. And there remain a lot of problems at the last group with people who are injecting drug users, people who don't have insurance, things like that. So that we need curative therapy like we have for hepatitis C, and we need a safe and effective vaccine to prevent people from becoming infected. But we've come a very long way and have a long way to go.
Do you think that we're any closer to an HIV vaccine today than we were in 2002?
Yes, but it's not a guarantee.
Right.
In other words, there's one vaccine that was partially effective. There's still quite a few people working on it, but there's no guarantee.
Dr. Curran, if you could go back and talk to yourself during this time, what advice would you have for yourself as a young public health professional?
Well, I think that, my life and the life of tens of thousands of others were transformed personally and professionally by the AIDS epidemic. And of course, nobody knew it even existed before 1981. I think that the important thing is to, I'd say the great thing is that public health will continue to offer many, many challenges, and through priorities and opportunities, we'll be able to address those challenges to save lives and populations in the United States and throughout the world.
What did you learn about yourself as a public health professional, and possibly more importantly, what did you learn about yourself as a person?
Well, it's what you learn about yourself, of course, is highly colored by what you want people to think you learned about yourself.
Right.
But one thing I think is that epidemics are very humbling. We can be pleased with things that have happened and any role that you might have in trying to deal with it, but you realize that the public health challenges will continue.
Mm-hmm.
And rather than feel gratified, you have to feel humbled, and you have to feel, I guess, honored to be able to contribute.
Mm-hmm.
So I think a combination of humility and confidence are what I learned. It's important to be confident, but you can't be confident unless you're humble first.
Right.
Or maybe rather than confident, I'd say courageous. It's
Yeah.
important to recognize the limits of your own ability and what else can be done, but then be courageous to push those limits and redefine what's acceptable.
I think that's a very important message for everyone to hear in 2018. Have there been any epidemics since then that have concerned you as much as AIDS?
Well, I'm always concerned about influenza and influenza epidemics, because influenza not only is a variable and the vaccines are very inadequate. I mean, I get a flu shot every year, but they're not what they need to be. And we really need a universal flu vaccine that will prevent you from needing a flu shot every year. And then the ones every year have to be better. But influenza epidemics are very scary because they come on so fast and kill so many people. So that scares me. I remain concerned about emerging infections like Ebola, like SARS, like other things like that, and drug-resistant tuberculosis, drug-resistant bacterial infections that occur in hospitals. I'm concerned about the diseases of aging and our ability to deal with them, and I'm concerned about the capacity and organization of our healthcare system to provide quality care to everyone. But I guess in the world, I'm most concerned about the issues which threaten us on a broad scale. Mm-hmm. And they include huge disparities in income and capacity throughout the world, poverty, in other words. And they also include political turmoil, which is also related to poverty and related to population control. And then the issue of global warming and the changes that makes.
Well, we definitely have our work cut out for us. So what advice do you have for us? What advice do you have for public health leaders and managers about how to stay vigilant in moving forward and protecting our citizens and discovering?
Well, I think the important thing is to pick a topic that you're interested in and passionate about, where you think you can make a difference, and then work hard and do it, and partner with others. I think a lot of what public health does best is networking and partnering with other people in areas where you can make a difference.
Like that. We have one last question for you, Dr. Curran. What books are you currently reading right now?
Well, there's a couple I'd recommend that are related to AIDS. One is a book by David France called How to Survive a Plague. This book was written after his documentary, which was Oscar nominated a few years ago. And it's the story of AIDS activism in New York City. It's not a perfect book, but it gives you a good idea of how activists survived the plague and how many who didn't, and how they interacted with science and public health. I read another book called Plagues and Paradox by Tom Balicki yesterday, and it's a discussion of why the survival rate from infectious disease hasn't resulted in the same trajectory economically and upwardly in developing countries as it did in the industrialized countries in the last century. So that book is an interesting, thoughtful book.
Well, Dr. Curran, before we wrap up, I'm just wondering if do you have any final last thoughts or?
No, I think that the one thing I would say on the 30th World AIDS Day is that public health is a wonderful place to work. It's an area that and you can work privately or you can work for government or non-governmental organizations, but it's an honor to be able to actually work and make a living doing something where you can help others and see the big picture. And so don't ever give up. Just go for it.
Thanks, Dr. Curran, and we really appreciate you taking the time to speak with us, and really truly appreciate your guidance and advice.
Great. Thank you.
Bye. Have a nice day.
Bye. Bye.